So the next 45 minutes, we will talk on mastitis. Okay. Just before telling why these new ideas, get 2 or 3 things very straight. One, the government of India has categorized antibiotics into 3. And many this is enough, okay. Many antibiotics that we are using has been put into the critical antibiotics. And India has signed an agreement which says that by 2028, all these antibiotics use will be banned from the food animal sector. Plus, any new antibiotics that is going to be discovered will not be permitted to be used in food animal sector, poultry and fisheries anymore. So we are going in for an era where antibiotics will not be available over the counter. In Kerala today, even today in Kerala, you cannot buy a single antibiotic tablet without prescription. It has come into effect in the last month itself. And regularly now we are having to fight with the drug inspector, with the drug controller for our right to prescribe these medicines, human antibiotics for the veterinary, the pet animals also. So antibiotic use is too much by the veterinarians. Of course, human doctors are far, far ahead of us. I agree, but we are at the receiving end of the government's policies regarding cutting down the use of antibiotics. So let us think about mastitis first. For every veterinarian, when an animal is presented with a case of mastitis, he diagnoses that case as, most of the veterinarians, they will diagnose the case as either coliform or non-coliform. Am I right? Then some of the veterinarians will think coliform, and the non-coliform is divided by some of them into streptococcal or staphylococcal. For many other veterinarians, the mastitis is either acute or chronic or peracute or severe. So all of us think of 2 things when we think of mastitis. One, which organism caused the mastitis? We classify mastitis based upon the organism. Other one, we think of the duration or the severity. And we select the antibiotic based upon 2 things. First is called as pattern recognition. That is, I have seen this case before. When I gave this antibiotic for a similar symptom, it responded. So next time I see the similar sign, I will use the same antibiotic. Am I right? Second one is peer consultation. I call Manjudha sir and ask him, sir, I have just joined your hospital. This cow has come with such a large udder. Which antibiotic is effective in this area? You were here before me. He will say, tetracycline is the best. So peer consultation. These things are wrong because mastitis should not be treated based upon the difference of etiology. I will tell you why. Okay. And for the past 5 years, so many people are following. All over the world, mastitis treatment diagnosis has changed. Here also, many people are starting to change. So what are the changes? I will tell you. For 1 minute, let us see what mastitis is. Mastitis involves 3 processes. The first process is called as invasion. The organism gets into the udder of the cow. There is no organism in the world, either it is 142 bacteria, 142 species of bacteria or virus or anything. There is no organism in the world which can produce mastitis by getting into the body through any route other than the teat orifice. If an organism wants to produce mastitis, it has to get into the udder through the teat orifice only. It cannot get in through water, it cannot get in through the air, it cannot get in through the food. Ectoparasites cannot inject. The only exception is mycoplasma. That is a separate case. Let us forget about the out-of-the-way cases. So the organism gets into the udder through the teat orifice. That is called as invasion, overcoming all the non-specific mechanisms. Clear? That is called as invasion. The next process is called as infection. The organism has started to multiply in the udder. This is called as infection. So invasion happens when all the non-specific mechanical barriers are breached, organism gets in. Now it starts the process of multiplying fast, very fast. This is called as infection. Clear? And the third stage comes, which is called as inflammation. That is, the body responds to the infection. Invasion, infection, inflammation. The body responds to this inflammation. And it is 100%, it is the response of the body to the infection by the process of inflammation that is called as mastitis. None of the mastitis organisms are specialists. They are not PhDs, they are not MVSCs, they are just BVSCs. They just multiply, they just multiply, they just multiply. They doesn't have the specific mechanisms of, let us say, Bacillus anthracis, who has got a specific toxin which destroys a specific organism. HS, who has got a specific target cell. They are not specialists. They multiply. The body responds. The response of the body is manifested as mastitis. The reason for mastitis in every case is the response of the body. Clear? It is not the organism producing toxins. It is not the something else. Organism going into the kidney and destroying it. Organism going into some area and destroying it. Organism going into the blood, like our hematoprotozoans. No, there are no specific organs where it is destroyed. It is a response of the body, which is called as inflammation. And that inflammation produces changes in three ways. Abnormal milk. Tell me the other two. Abnormal milk, abnormal udder, abnormal animal. Abnormal milk, so many colors. This depends not on the organism. It depends upon how the body responded to the organism. And how the body responded was defined by only one thing, the process of infection, how the organism was multiplying. Clear? Clear? The body's response is mastitis. It is not the organism's pathogenicity which produces mastitis. You refer any book in the last 5 years, 6 years, especially the Scandinavian books, they will tell you they have gone into extreme research. So this response is manifested as abnormal milk, abnormal gland, abnormal animal. Clear? I don't have to explain what are the abnormalities in milk. Change in color, change in abnormalities of udder, nodular structure, what is inflammatory nodules are the animal, fever, anorexia. So this is mastitis. The response of the body to the infection process, which depends upon the organism. Clear? Now we will go to the first case, because all the 142 organisms, just look at me for 1 minute before reading this, all the 142 organisms that produces mastitis can be divided into 3 based on the infection. Remember, mastitis is the manifestation of the inflammatory process which depends upon the infection, that is the multiplying property of the organism. Am I clear? So all the organisms can be divided into 3 based on the process of infection. All the 142 bacteria which produces mastitis can be divided into 3. So if the case that is presented before you, you are able to put that case into one of the 3 categories, because for each group there is a specific line of treatment. There is a specific line of treatment. So if you are able to place the case that is present before you, if you are able to place it into one of the 3 categories, you get a good idea which pathway shall I follow. Think of the first case. This is a cow. This is a cow that was presented 4 years. Normal feed intake since yesterday. This is how the owner tells you the history. The animal was feeding us normal till yesterday evening. There was nothing wrong. Yesterday afternoon milk, there was no reduction. Animal is feeding us normal. Today morning, there is a reluctance to feed. There is a reluctance to feed. It is feeding, but he is not completely wiping or licking off the bottom of the pail. He has left a part of the straw uneaten. I can feel fever. I have held her ear and I can feel it is warm. I have placed my finger before her nostrils and I can place this part against the nostrils. I can feel it is warm. So there is fever. But still the animal is eating. 1/4 of the milk, 1/4 of the udder is swollen. And it is tender to touch. If I touch, she lifts the head, lifts the leg to kick. Painful to touch. Milk is thin and watery. You can see the milk here, thin and watery. Other quarters are normal, but reduced in quantity. Remember how many cases you have seen, such cases. One quarter is only affected, other 3 quarters are normal. And that quarter is swollen, but it is not thin, it is not straw-colored, it is not hard to touch, it is painful to touch. So this type of mastitis is called as opportunistic mastitis. Why you call it as opportunistic mastitis? Because it is produced by opportunistic pathogen. What do you mean by opportunistic pathogen? Opportunistic pathogens are those who wait for an opportunity to get into the udder. Clear? Sir is sleeping. Good morning, sir. Okay. So, I can see everyone. So if you sleep, because sleep is contagious. And contagious diseases are to be controlled by culling. That is not possible. So I will just wake you up. Okay. Okay. So think this is opportunistic pathogens they are opportunistic pathogens because one, they don't have the capacity to go deep into the udder and remain there. Two, they don't have the capacity to fight with the other organisms in the mud and in the dirt things around the animal, the dung and everything. So opportunistic pathogens remain on the teeth surface, on the udder surface. They don't have the capacity to multiply very fast. They don't have the capacity to produce toxins. So any sort of mastitis produced by opportunistic pathogens will be one, confined to one quarter. Two, since they don't have the capacity to invade into the blood and produce toxins, there won't be any septicemia. There won't be any toxemia. There won't be any diarrhea. There won't be any fever. Mild fever is there. Why? One part of the udder is swollen. It is a part of the body, of course. But there won't be any severe, and you will not get the typical dehydration. Eyes are gone in profuse stringy salivation. You will not get. This is called as opportunistic pathogens. And among all the organisms that produces mastitis, antimicrobial resistance is the least regarding opportunistic pathogens. I will show you which organisms are there. So these four are the organisms which produces opportunistic mastitis. Antimicrobial resistance is very rare in them. They don't have the capacity to produce enzyme degrading enzymes. I mean antibiotic degrading enzymes like beta-lactamases. Are you familiar with the term beta-lactamases? So opportunistic mastitis, the history will be animal was clinically normal till yesterday evening. Today morning mild pyrexia, mild anorexia. Milk from one quarter is changed in consistency, one quarter is swollen, other 3 quarters are normal, slight reduction in field. So this is opportunistic mastitis. Think how many cases you see in your practice. 10 to 12% of all mastitis cases will belong to the opportunistic. And this is where the livestock inspectors shine. The normal quacks will shine. Why? Because they don't have the capacity to resist antimicrobials. Any antimicrobial, any antibiotic that you give parenterally, if it is excreted in the active form through the milk, this mastitis will respond within 2 to 3 days. Your streptopenicillin will result. 2 vials of streptopenicillin, tetracycline. The only thing is that the antibiotic should be excreted in the active form through the milk. So your ceftiofur will not work. Why? Ceftiofur, what's the best thing about ceftiofur? 0-day milk withdrawal time. Why? So ceftiofur will not work for this. Any antibiotic that is excreted unchanged through the milk will work for them. 10 to 12% of cases. These are the cases which gives us some good name in the practice. So this is opportunistic mastitis produced by opportunistic pathogens. Okay. So the same thing I told, I am showing in the writing. Surface of the body or the skin. Entry through the teat orifice. Causes typical mastitis with moderate pyrexia, localized inflammatory changes, and watery milk with clots. Okay. So, how to treat? Mastitis treatment involves 3 things. All type of mastitis treatment has got 3 parts. 1, antibiotic. 2, anti-inflammatory. 3, fluids. Everything else is secondary. Anti-inflammatory, antibiotic, fluids. So for this case, can you tell me which of them will be useful, which will not be indicated? Are antibiotics indicated? Definitely indicated. Are anti-inflammatories indicated? No. Why? Because it is only a localized inflammation. You can go for topical anti-inflammatories. No need of systemic Are fluids indicated? No. Why? There is no septicemia. There is no toxemia. Why you are going to give fluid and waste your precious time on this? So you will need an antibiotic. Which type of antibiotic? Antibiotics that are excreted unchanged in good quantities. That is less bound with the blood protein. So that most of it are excreted in good quantity through the milk. Those antibiotics are required. Clear? So this is the picture of some cases of opportunistic mastitis. 1/4 is affected. Can you see this? Okay. So antibiotics, for this, antibiotics are required. Clear? Anti-inflammatories are not required. And fluids are not required. Which antibiotics are best? Any of these antibiotics are extremely good because they get excreted in good quantities unchanged through the milk. Any of them. Any of them. So beta-lactams means all group of penicillins, amoxicillins, all those things. Cephalosporin, ceftriaxones, everything. Aminoglycosides, quinolones and macronolactones. Quinolones and macronolactones are not required because they are very strong antibiotics. The first two are far better and cheaper also. So for this case, next time when you see a case of this, don't think of going for 2 antibiotics. Don't think of going for flunixin as an anti-inflammatory. If signs are like this, you go for a single antibiotic, but make sure that the dose and route are correct. I will come to that later. If I get time, the last slide, that is regarding the antibiotic. So this is opportunistic mastitis. Clear? Any doubts? Or you can reserve your questions to the last of the presentation. Okay. Now we go to the next case. 10 to 12% you are going to, I am sure that all of you have seen such cases. So, but you would have diagnosed it as a streptococcal mastitis or a staphylococcal mastitis. Am I correct? Or chronic mastitis or subacute mastitis. It is not, it is opportunistic mastitis. Clear? The next. So this is in a nutshell about opportunistic. Moderate inflammation, rarely septicemic, rarely established. They don't have the capacity to remain inside the udder. So there is no spread from one cow to another. Unlike the contagious mastitis. Here there is no spread. You treat the animal, even otherwise the animal will get rid of it in 6 to 7 or 8 days. That's why homeo people are doing wonders and so many natural remedies are doing wonders. Okay. Next comes our most important type of mastitis. The animal was normal till yesterday evening. The owner will say, yesterday noon, the milk yield was normal. Yesterday noon, the milk was normal. By evening, the animal had fever. When I went there, he was drowsy, droopy. The night straw that I have put, she hasn't eaten in the morning. When I went there in the morning, the animal is recumbent. Her eyes are sunken. She has got some diarrhea, extreme dehydration. That is, her fat has melted off from her body. What is fat melting off? Fat is not melting off. The animal has lost a lot of water. Dehydration means the owner will think it is the fat has gone because the edges of the ribs become prominent. Clear? So dehydration, sunken eyes, extreme fever. Animal is recumbent. Why it is recumbent? Because of myalgia, extreme muscle pain. Animal is unable to get up. When we have fever, what do we feel? So animal is unable to get up, there is extreme fever, myalgia is there. So, and today morning, yesterday noon milk was normal. Today morning when I went there and milked, I saw that milk from one quarter is straw colored and clear. And that quarter is swollen like anything. How many cases you see every day? So this is our most famous or infamous coliform mastitis. Okay, so straw colored, one quarter is swelling like anything, swollen like anything, milk is straw colored, no secretion at all from the quarters. So this is called as coliform. These are produced by a group of organisms called as environmental pathogens. Why environmental? They are capable of surviving in the environment, fighting against all the other bacteria. How they are capable of fighting, how they are able to defeat all the other bacteria, they have got 2 properties. One, the capacity for exponential multiplication. Multiplies into billions within a short time. Second, the capacity to secrete toxins. both endotoxins as well as exotoxins. So when the exotoxins are secreted, the other bacteria are killed. When endotoxins are, this bacteria is killed, it acts like a chower. Why? The endotoxins are released, kills all the others. It acts like a suicide bomber. Why? Because it has got endotoxins inside. When the other bacteria kill it, the endotoxins are released. So this has got the capacity for exponential multiplication, has got the capacity for secretion of endotoxins as well as exotoxins. The third capacity is they are invasive. They can get into the bloodstream, cause septicemia and toxemia for a short period. And this is one mastitis where we use the maximum amount of antibiotics. Am I right? Today morning, a coliform mastitis came. We started with one antibiotic. Next day, the person comes back with animal is in the same condition. So we add another antibiotic. And invariably, the second antibiotic will be of a higher grade than the first one. Sometimes we will go for 2. First one will be continued, we will add for the second. Third day again, it will be presented. Now our heart is palpitating. Why? This animal has not taken food for the 3 days. It is going down. The next veterinarian is a very good one. If this fellow goes there, our practice is doomed. So we go for a third antibiotic. And that third antibiotic will be the highest order. We may even go for meropenams. We may even go for very extra, linezolid, human antibiotics. This is one case where we use antibiotics non-judiciously. Why? Because, now you have to hear this very carefully. You are not going to agree, so I tell you, go and refer and refer and refer. There is no coliform organism in the world. There are 4 which produces mastitis: Enterobacter, E. coli, Acetobacter. There is no coliform organism in the world which can survive for more than 36 hours in the body of a cow, because coliforms doesn't have immunosuppressive property. Any coliform organism will be removed from the body of the cow within 24 to 36 hours. Then you will ask me, how come the clinical signs are continuing? If the body removed the coliform organism, coliform mastitis may continue for 6 days. How it is continuing? The same straw-colored milk is coming. The same fever is there. How come? If the organisms are gone, what happens in the body? There is no organism. You keep this in your blood, you refer anywhere. My phone number is there. You tell me you call me anything you like if you find any other references. There is no coliform organism which is able to survive for beyond 36 hours in the body of a cow. So what happens in coliform mastitis? So that the clinical signs are extended for 5 to 6 days. For coliform mastitis, other signs are there. I will come to that. Other signs are there. Eyes will be closed. That is photophobia, blepharospasms. Eyes will be sunken, dehydration, conjunctivitis. All those things will be there. So coliforms are present on the outside. It goes in through the milk. And what will happen? I will tell you an example. Okay. A small example. Sir, good morning. Okay. You may fall onto the camera. That's why he's a bit poor person. Okay. So what is there? Suppose there is a stop called A, and suppose you are going to your workplace, and that office is at a location called B. The stop immediately before B is stop A. Okay. So you are in the bus. When you reach stop A, conductor calls stop A. So you get up, you move through between the passengers without hurting anyone, turning sideways. Most of the people will do. Others may push, but turning sideways. And when stop B comes, you get out without causing an injury. Is it? That is called as diapedesis. When there is an inflammatory change, the neutrophils will come. They will move into the site through the gaps of the cells, gaps between the cells of the capillary endothelium, capillary inner lining, without destroying the capillaries. That is called as diapedesis. Suppose you had a party like this on the previous day and you slept on the bus. Suddenly you hear a sound, conductor calling, stop B, stop B. So what you will do? You will get up, you will burst out of the bus, destroying everything in the path. You will elbow the people, you will kick the people, you will push the people away. Damages are caused. Here, when when the E. coli are multiplying in the udder, the multiplication rate is so fast. The toxin production is so high, the neutrophils, instead of the diapedesis process, burst out of the capillaries, destroying the endothelium. And when the endothelium is destroyed, what will happen? Blood will ooze out. When the blood oozes out, what will happen? It will clot. When blood clots, what is produced? Serum. And the serum will accumulate in the gland system. When you milk out, you are getting the yellow colored serum. The pH is 7.1 to 7.2. It is not the pH of the milk. It is the pH of the serum. You send it for culture, the lab will come back. You tell that there are no organisms detected. Or that lab is like that from previous years onwards. It is not working properly. No, it is serum. What other proof you require? I will show you 2 more proofs. You look at the udder of the cow. You look at the udder of, this is typical coliform systemic response. Next photograph. So this is them bursting out of the, and this is the cut section of the udder of a cow with coliform mastitis. See the damage that has happened to the epithelium of the teat as well as the udder. There is no other disease which can produce this level of damages. Through each orifice, the blood is coming out, clotting, serum is oozing out. And when you look at the udder here, you can see some drops here. When you squeeze the skin of the udder, be careful, the animal will kick. You will find that serum oozes out of the skin also. You wipe your hands well, rub it over the udder, bring the hands together, they will stick together. Why? There is a lot of protein. This is a serum. The response, the clinical signs of coliform mastitis are entirely due to uncontrolled inflammatory changes by the body, which are not dependent upon the presence of the bacteria. Why? Because the changes in the hypothalamus are so vast that even after the organisms are destroyed, the same inflammatory process will continue for the next 48 to 72 hours. Whether the E. coli is there or not, body doesn't bother, because cytokine response is so severe. That is why you get clinical signs for 3 to 4 days. Clear? Organisms are not important after the first day. What is important is the body has mounted an uncontrolled inflammatory response which is harming the body. And you are not doing anything to control it. You are still targeting the organism with one antibiotic after the other. Very few people will think of giving a lot of fluids to control the septicemia and toxemia. One more story I will tell. Time, 15 minutes has to be extended. Okay. One more story. I had a senior colleague called Dr. Meera. He went and joined a hospital in Israel. 2,000 cattle were there. And she joined on, it was only 4th day of her employment. When she was walking down through the passage between the rows of the cows, she saw a typical coliform mastitis case. The animal was lying on the side, the leg was kept back, the udder was just like a mountain with a severe color change and all those things. She was very happy because her superior was a European veterinarian. She wanted to impress that veterinarian. So and in Israel, you are not permitted to go and take antibiotics according to your will and fancy. They are kept locked in a cupboard. You have to write everything. You have to tell, I have taken it. So she was asking, where is a cupboard, where is a lock and all those. The European came, Dr. Meera, nothing doing. Just give her some fluids. Don't give her any antibiotics. She gave 4 liters of fluid. She says the animal was recommended for 4 hours, 5 hours, then clinical signs started to abate. The animal got up by 6 hours. Why? Because you control the toxemia. You control the inflammatory process. Antibiotics are of secondary importance. I don't have the courage, sir, to do this. You have the courage. There are people who are using only oxytetracycline for E. coli in my district, in my state, many people, and they are getting results. Your treatment should be oriented in controlling the toxemia. How many are giving fluids? I have given 500 ml, sir. I even gave 1 liter. No, 10 to 15 ml per kg. That is 4 to 4.5 liters. I don't have time, sir. There are 10 cases waiting, and 8 o'clock I have to report. The district officer is very rude. Do one thing. What we do is, I don't know whether it is ethical or not. We affix this intravenous cannula to the ear to the ear vein. We tape it tell the owner to give one after the other. If there is any complication, you stop this. It is only a cannula. It is not a hypodermic needle. It is a size 18 cannula. You insert, you tape it, tell the owner. It will take 2 hours, 1 hour 45 minutes for 4 liters to go. The owner will give. You are just giving him the fluids. Just connect one after the other. If there is any issue, animal is moving, you just remove it. 4 liters of fluid plus a very good steroid or a very good anti-inflammatory agent plus an antibiotic that is for general protection purposes. Clear? That is all that is required. Try this. You will be grateful that you came to this class today because it works really well. So try this. So for this, 5 minutes left. For this, think of 3 things. Antibiotics, required, but the first level. Anti-inflammatories, must. Fluids, must. Antibiotics are required. So any antibiotic will be effective. Ceftiofur, a very good choice. Tetracyclines will be a very good choice. For anti-inflammatories, flunixin is a very good choice. Flunixin. Even prednisolone can be used at 1 milligram per kg. It is good choice. Go for isotonic fluids, 4 liters. 4 liters of isotonic fluids. That is a must for the treatment. And don't go for higher antibiotics for coliform mastitis. You will not miss coliform mastitis. You will easily be able to diagnose it. Go for this. How does the organism spread? If it is to be spread from one animal to the other, it has to come out through the milk, because as we told, there is no other way. The organism has to come out through the milk, and either through the hands of the milker or through the milking machine, it has to spread into the other cow through the teat orifice. If an organism is coming out through the milk, that means that organism should be staying inside the udder. Am I right? Inside the udder. If an organism is staying inside the udder, that means that organism should have the capacity for 2 things. First, to go into areas where it is not washed out through the secretion of the milk. 2, to go into areas which are inaccessible to the immune system. And maybe 3, to have the capacity to destroy or overcome the immune system. These 2 are almost similar. Residing in areas which are inaccessible to the immune system, having the capacity to overcome the immune system. So, contagious mastitis means an organism is staying inside the udder in areas which are inaccessible to the immune system. So, how does it reach that areas? This organism, it doesn't have anything to penetrate. This organism is capable, or these organisms are capable of secreting enzymes which will destroy the parenchyma little by little so that they can move into deeper areas. So there is necrosis of the parenchyma. And they reach into the deepest areas, remotest areas of the udder where they will remain. Clear? So how do they reach? They secrete enzymes. How does the body respond? Whenever there is necrosis in the body, like a small pin or a small shard has poked our area, a small abscess is formed. Clear? So the body responds by forming small abscesses. Micro abscesses be joined together to form macro abscesses, larger abscesses covered by fibrin. So contagious mastitis means organisms are located deep in the udder, in areas which are not accessible either to your antibiotic or to the immune system. And they are present, and they stay there by multiplying very slowly. So the owner will come and say, "Sir, remember the cow I presented 2 weeks back? You treated for 3 days, it became normal. Now today again, the milk from 1 quarter is white in color, but when I sieve it, I can see so many white clouds in the sieve. And the society people returned it, sir, telling that this is having a smell. That is the tea shop owner returned it, telling that it is having a smell. It coagulates when it is heated. Society people say this is not, the entire can was rejected. Remember such cases? And remember, sir, last month also I bought it for twice. Before that, I was going to the other veterinarian. He treated for 3 weeks. Then they said, you are better. So continuous or recurrent episodes of subclinical to mildly clinical mastitis. How many cases you are getting every day? Clear? So, and when you palpate the udder, you feel there is some hard nodules. What are these nodules? The abscesses that are formed. Micro abscesses joining to the mass. So when you find a cow that is being presented repeatedly to your clinic with a history of recurrent mastitis, mildly clinical to subclinical mastitis, and very rarely when the animal is in heat. Sir, yesterday the animal was in heat. She didn't permit me to milk her. She kicked me, so I went away. Today there is swelling. So sometimes when there is accumulation of milk, you will get some sort of clinical mastitis. One quarter will be affected, then sometimes even the second quarter. Why? Because from the same animal, through the hands of the milker, the other quarter can get affected. 52% of our mastitis are this, subclinical. For every case of clinical mastitis, 27 subclinical mastitis will be there. Losses are much more, but that is the most underdiagnosed mastitis as far as the veterinarians are concerned. Why? Because recurrent mastitis, no clinical signs, very rarely you will get. So why it is important? Two things. One, the body responds by sending in somatic cells. Somatic cell count increases. For every 1% of somatic cell count increase, there is a 1.5% reduction in milk. So subclinical mastitis causes around 25 to 27% loss in milk production all over India. It is not a threat to the animal, but you can find that there is hard nodules and one more complication. This is fibrous tissue. It will not be tolerated by the body. Body has two options. One, the fibrous tissue may contract, pulling that quarter up. Now my cow is having only 3 cylinders, or previously it was having 4 cylinders. 1 cylinder is up. Or the body may decide to expel the fibrous tissue. Have you seen such cases? God forbid. The entire thing is broken, ruptured. This is contagious mastitis. Organism like Staphylococcus aureus, some coagulous staphylococci, which remain deep inside the udder, forming abscesses, forming biofilms. And in addition, two more things. They are the most notorious for having antimicrobial resistance. Remember MRSA? What is MRSA? Methicillin-resistant Staphylococcus aureus. Again, they have the capacity to transfer antimicrobial resistance through plasmids to other organisms. So this forms the major part of mastitis, which are residing in locations not accessible, have the capacity to overcome the body immune system, have the capacity to resist antibiotics, a great extent. How many cases you are getting? Everyone will be getting some. After 2 or 3 times, you will tell, you go to the next doctor, I can't treat it. Or you will prescribe homeo medicine for the next 60 days. Good riddance. Why? Because you don't, that person is bringing it again and again. So how do you treat it? There is no way you can treat a case of, you can cure a case of subclinical mastitis through parenteral route, because your parenteral antibiotics doesn't have enough capacity to reach. The only way you can treat is through an intramammary route when the animal becomes dry. Dry. When the animal becomes dry, you check the milk, send it for culture and sensitivity, you go for intramammary therapy, pray to every goat, give kanikya to everything, so that 52% of the cases are recovered in the next lactation. 48% doesn't recover. And in Europe, Eastern Europe, Scandinavia, US, they have banned treatment of contagious mastitis cases. It is slaughter, stamping out. Why? Two things. One, this spreads the disease to so many other cows before it is diagnosed. Two, it is the cradle for the antimicrobial resistance. So when you get such cases, tell the owner, inseminate it, get it conceived as early as possible, make it dry, go for the culture. Go for the culture. If possible, give. Then there is one more very important thing. If you just give an intramammary antibiotic, it will not work. You have to make sure that no further microbial infiltration happens into the udder. You have breached the dry cow's defenses. So you seal the udder. How do you seal the udder? You purchase bismuth subnitrate. Bismuth subnitrate. You purchase liquid paraffin. You mix 600 milligram of bismuth subnitrate per ml of liquid paraffin, 60% solution. 600 milligram per ml. So 100 ml means 60 grams. You boil it for some time, let it dry so that it dissolves. You mix it very well. After it is cooled, you insert the teat into this. Take it out. Bismuth subnitrate will go in up to 1 centimeter. It will stay there for 30 to 40 days. Afterwards, again you do. You seal the teat for any cases. Or you can purchase this bismuth subnitrate 60%, Orbi-Seal, imported. Amazon it is available. Per vial it is, per tube it is 300 rupees. For a cow it is 1200. Or you can make it yourself. So you seal it very well. And in the next lactation, if the condition happens again, dispose of the animal. Dispose of the animal. My last minute, I am going to tell you two things. One, antibiotics. One more minute. One more minute. Antibiotics. There are two types of antibiotics. It is not static and settle. Forget about it. That is for the exam purpose. What are the two types of antibiotics? Dose dependent, time dependent. What do you mean by dose dependent? Dose dependent antibiotics are those antibiotics whose efficacy increases as you increase the dose to a level beyond which it will not happen. Whose efficacy increases as you increase the dosage. There are only two dose dependent antibiotics which we are using in the entire veterinary field. There are only two. One is the quinolones, other is aminoglycoside. Tetracyclines I am not counting, quinolones and aminoglycosides. Enrofloxacin, the dose is 5 milligram per kilogram body weight. Efficacy increases if you increase the dosage to 7.5 milligram. It further increases if you increase the dose to 10 milligram. If you increase to 12.5 milligram, there is no more increase, up to 10. So up to a level, increasing the dose can have increase in efficacy. That is for dose-dependent antibiotics. Two antibiotics only, enrofloxacin and aminoglycosides. Aminoglycosides, if you increase the dose, what will happen? You know. What are the problems? So you are very well aware. So even though aminoglycosides are a dose-dependent antibiotic, nobody uses their property because that will cause so much harm to the body. All other antibiotics that we are using in veterinary field is time-dependent. That means you maintain the MIC level through frequent administrations. Beta-lactams, cephalosporins, everything. So, if you are using amoxicillin, say for example, 8.75 milligram per kilogram body weight, 3 times a day is better than 12.5 milligram twice a day, which is even better than 25 milligram once a day. So 25 milligram once a day is the least effective. Now think of your mastitis treatment. How many times we have thought, this is my severe mastitis, I will increase the cephalosporin dose to 80 milligram per kilogram body weight. It is not a dose-dependent antibiotic. So in future, when you treat mastitis, don't indiscriminately increase the dosages because only for 2 antibiotics it works. Others, I know under field conditions, frequent administrations has got many practical difficulties. I worked for 20 years in the department, so I know what it is. But that is the only way if you want to improve it. Last 30 seconds on culture and sensitivity. How do you measure culture and sensitivity? You send the sample, the laboratory people streak it onto a primary medium. After 24 hours, they take the colony, take it to another medium. On that medium, they place so many antimicrobial discs. After 24 hours, they measure the distance. 8 mm clearance zone, highly susceptible. 4 mm less susceptible. It is different for each antibiotic. So who decided 8 mm was highly susceptible for oxytetracycline and 4 mm was less susceptible? All these data is taken directly from the human health, where they have gone for the tissue concentration achieved by the antibiotic in the target tissue when it is given at the correct dosage through the correct route. In human, correct dosage, correct dose, tissue concentration, target tissue. For us, what route, what tissue, what target. So they are not directly applicable to the veterinary practice. If you do 100 antimicrobial sensitivity in your area, you will get a good idea that in my area, this antibiotic may be effective. For a single animal, there is no guarantee that it will work. That is why the result will come resistant to OTC and the animal has cured, because result took 72 hours. By that time, the animal is normal. You have been giving OTC. Why? That will not have any direct impact on this. Okay? So with that, I am finishing. Any doubts, I'll be happy to accommodate and answer all the questions. I'll be coming to that dinner also. So with thanks to all this.